Good day to everybody. My name is Shamsi Al-Hassani. I am consultant specialized in upper gastrointestinal, keyhole and minimal access surgery. I thank you for making the time and effort towards this presentation, which I hope it will be of educational value, and I will keep it short. The aim is to share with you the contents of an article that we have recently published about our series of a new method we adopted to repair abdominal wall, or it is called ventral hernias as well. In the past, we did speak about inguinal hernias, we did speak about hernias in general, but today we will talk about abdominal wall or ventral hernias, and this includes a wide variety of hernias. Hernias through the tummy button, which is called umbilical or parumbilical hernias. Hernias above the tummy button, called epigastric hernias. Hernias on the sides of the tummy button, which is called Spagelian hernia. And this collection of hernias even include incisional hernias, which are hernias that protrude through a previous incision in the abdominal wall. The traditional method or technique to treat these hernias is to make an incision on these hernias, reduce the hernias, apply a mesh anterior or above the defect through which the hernia had protruded. Over the years, another technique or method had evolved, which is the laparoscopic approach. Each of these techniques have its advantages and disadvantages. The method that we are contemplating is a combined laparoscopic and open approach, basically taking the benefit of both procedures. In our hand, in our series, we find this combined method is superior. The pain is less, recovery is quicker, return to daily activity is quicker, the complication rate is less, and 2 years follow-up had shown that the recurrence rate so far negligible, bearing in mind the most of these cases are done as a day case. So basically, if you have one of these ventral or abdominal wall hernias and you are fit for general anesthetic, we will ask you to think about having it repaired, because hernias can only get bigger and cause problems, and there's always the real and rare risk of having strangulation or obstruction. And if you want to have the new method, which is combined laparoscopic and open, we are very happy to be at your service. Thank you for listening, and I wish you all the best.